This video will provide agency owners and solo providers with information needed to prepare for accessing APD iConnect. We will discuss multi-factor authentication and why it is needed. You will learn what you as agency owners or solo providers will need to do to be able to access APD iConnect when it rolls out to you. We will review the roles and permissions within the APD iConnect application. We will also review how agency owners will request user access accounts for their employees. And finally, you will learn what to do if you or an employee should lose your password and need to reset it. APD has adopted multi-factor authentication to access internet-facing APD systems such as APD iConnect because APD iConnect contains HIPAA-protected information. It is important that all providers understand that accessing APD iConnect is giving you and your employees, if you're an agency, access to sensitive confidential data. The MedWaiver Services Agreement binds providers to comply with HIPAA and all applicable regulations provided in Chapters 45 and 42 of the Code of Federal Regulations. It is your responsibility to ensure that access to APD iConnect is granted only to those people who need to have access in order to do their job. Providers who inappropriately grant APD iConnect access or fail to terminate access when a person's employment ends is in violation of HIPAA. This could potentially result in termination of the MedWaiver Services Agreement, and legal actions could be taken by the Department of Health and Human Services Office for Civil Rights or the state's attorney's office. So how does multi-factor authentication work? In a traditional computer system, you typically only need to have a username and a password in order to log in. Your username is who you claim to be, and your password is evidence that you are who you say you are. But the password is really only one piece of evidence. With multi-factor authentication, APD requires more than one piece of evidence. The first piece of evidence can be your password because it's something that you know. But the second piece of evidence has to be something that you have. It will either be your cell phone or a landline phone, a place where you're able to either receive SMS text messages with a one-time passcode or receive a voice phone call and then enter a PIN in on the keypad. Or you could use the mobile authenticator app on your smartphone. Once you provide that second piece of evidence, you'll be able to get logged in. As APD prepares to roll APD iConnect out to providers, certain information will be needed from you to complete identity proofing. That will include your first and last name, your personal residential address, your date of birth, a unique email address, and by unique, what that means is that it is not shared with anyone else, and a telephone number. This is required to ensure APD does not grant access to APD iConnect to anyone other than waiver support coordinators and agency or solo providers of iBudget waiver services who have a valid MedWaiver Services Agreement. This information will not be shared with any other users. It is used with APD's third-party partner for the sole purpose of identity verification before creating an account with the ID Proofing Admin Security or ID Pass system. An ID Pass account is required for all agency and solo providers in order to be able to access APD iConnect. As we draw close to rolling APD iConnect out to providers, each provider will be emailed the instructions for how to complete identity proofing. You are encouraged to keep monitoring the provider advisories that are posted on our website and listed here with the link. Also, please note, sometimes those emails get sent to your spam or your blocked folders. So when you see the provider advisory indicating that we are going to start emailing those instructions, start monitoring those other mailboxes on a regular basis. Since APD works with a third-party partner for identity verification, it is important that agency and solo providers understand that the first step to getting access for APD iConnect is completing the identity proofing process. You will want to look for an email from the APD Online Application User Account Service, It will come from a noreply@apdcares.org email. Within that email, there will be a link, and that link will have an expiration date. So you want to make sure, again, that you're monitoring your spam or your blocked folders so that you can get that email before the expiration date. Simply follow the instructions in the email to create your APD iConnect account. Also, once the notification goes out that we are sending the emails, if you don't receive an email, please contact the APD iConnect support desk at 1-800-353-5168. Once you've completed your identity verification, agency owners and solo providers will be provided with a username by the ID Pass system. Users will be able to choose their own password during that registration process with ID Pass. You will start by accessing the apd.direct user management portal at this link here on the slide, apddirect.my.centrify.com. Enter your username that's been given to you by the ID Pass system and click Next. And then enter the password chosen when you set up your user account with ID Pass. This is what you will see when you go to that apd.direct user management portal to start the login process. After entering your username and password, select your choice for your second authentication factor and click Next. You will receive that second separate authentication request via the option that you chose. Keep in mind that when you completed your ID Pass registration, you already have registered at least one phone number. And this slide is an example of what you might see after you've entered your password. You'll see here that there are the text message and the two phone options. And again, this is something that you set up during your ID Pass registration process. You also can choose to enroll your personal smartphone if you want to use the mobile authenticator app. A smartphone can use the mobile authenticator app even when that phone number is not entered in your profile in the ID Pass system. It is important, though, that your smartphone have fingerprint or face recognition enabled on it. Otherwise, the mobile authenticator app won't work. For information regarding setting up fingerprint or face recognition, please see the Access to Internet-Facing APD Systems document that's located in the APD iConnect e-learning library. These are the links for either the Apple App Store or the Google Play Store to download the iDaptive Mobile Authenticator app. These links can also be found in the Access to Internet-Facing APD Systems document that is posted in the APD iConnect e-learning library. After you've installed the iDaptive app on your personal phone, simply return to the user management portal at apd.direct and click on the Devices tab. From there, you'll be able to see an Add Devices button on the left side of the page. Here you can see at the top, and number 1 is the Devices tab, and number 2 is the Add Device button. After you've hit that Add Device button, go back to the iDaptive app on your phone and touch that QR code icon in the bottom left corner of the app screen. Then you aim your phone's camera at the QR code on the user management portal, and your phone will automatically begin the enrollment process. After that, you simply just follow the instructions that your app provides. And here's just a visual of what I just said. You can see with number 1, that's the QR code in the bottom left-hand corner of the iDaptive app on your phone. And then number 2 is the same QR code on the Add Devices screen in the user management portal. After you've set up your ID Pass account and then registered your smartphone, now you're ready to log into APD iConnect. You will always start by accessing that apd.direct user management portal, and then you will enter your username and password and choose your second authentication factor. Any phone numbers that you registered during the ID Pass registration process or any device that you've enrolled to use the iDaptive app, that will determine what you will see on the authentication method screen after you've entered your username and password. This is an example of all of the options. If you've chosen to use the mobile authenticator, you'll receive a login request through the iDaptive app, and then you just follow the instructions and touch that approve on the login request under the notification screen within the app itself. And if you don't see that login request, in the upper right-hand corner on the app, there's a bell for an alert, and you just click on that and it'll take you to the notification screen. If you've chosen text message, then you'll receive an SMS text message containing a code and a link, and you can either take that code and enter it in to the system's login form, or you can simply click on the link and it will open your smartphone's web browser and you can approve the login request from there. If you chose phone as your authentication method, you'll receive an authentication phone call, and when you're prompted, you'll use the keypad on your phone to enter the PIN that you set up when you completed your ID Pass registration. It's very important that if at any time you receive an authentication request via any method, phone, SMS text, or the mobile authenticator app, and you're not logging into an APD system, it could mean someone is trying to log in as you. So you want to deny that request and then report it immediately to the APD Information Security Team at security@apdcares.org. Once you've completed multi-factor authentication, you will then be directed to the User Management Portal. The APD Applications icon will take you to APD iConnect, and the ID Pass icon will allow agency owners to use the ID Pass system to manage employee user accounts. Inside the APD Applications portal, you will see icons for any applications that you're authorized to access, such as APD iConnect. Clicking on the icon will open the application in a new window. You will not have to log in again because you've already logged in through the portal. Since APD iConnect is a statewide database of both consumer and provider information, there are security measures in place that limit a user's access. It's done by the roles and permissions that are set up within APD iConnect. When your ID Pass registration is completed, based upon a person's job, they might be assigned a role or multiple roles, and each of those roles have specific permissions for what that user can see. Providers will have access to a maximum of 5 roles, and we'll go and talk about what each one of those roles do and what they can access. The service provider role is the primary role that is given to agency owners and solo providers. It will grant access to your agency provider record, and it should really be limited to only you and designated staff that you authorize in writing to act on your behalf. Here are some examples of what the service provider role can see and access in APD iConnect. As an agency owner, you will want to be careful about who you give the service provider role to. Think in terms of who you would allow to have that level of access in your business today. This is a role that will also be able to see and submit claims for your agency, see your authorizations. So again, you want to think about, who do I already give that level of access to? Some large agencies who operate in multiple locations may want to designate a representative from each region to have that role. Ultimately, as an agency owner, though, it is your decision to decide who should have this role. This is an example of what you will see when you log into APD iConnect with the service provider role. You'll get more in-depth information about what each of these tabs do within your provider record, but just wanted to have you take a look at this. So again, you can think about some of the information that the role is able to access and who do you really want to give that level of permission to. The service provider admin QA role also gives access to your provider record, but not all of it, just portions of it. It was designed with the administrative support person in mind, that person who may assist you with agency management. So some of the information they can view only and not edit, whereas there's other information that they can actually add or edit new information. Agency owners may wish to use this role instead of the service provider role for staff who help with administrative work. For example, this role can submit a facility application for renewal for licensed homes that are operated by the agency, or work with the region through the MedWaiver Services renewal process. This role also has access to view authorizations and submit claims. So again, think about who you would give this level of access to in your physical office and files today. The service provider worker role was designed for employees of an agency who need access to a consumer's record to deliver services and enter documentation. This role can't see your agency record at all. They don't have access to authorizations or claims. But it is the role that you will want to give to employees who will deliver electronic visit verification or EVV services, such as respite, personal supports, and nursing services provided in a non-licensed setting. You will learn more about electronic visit verification in subsequent training. But the provider EVV manager role is designed for the person who will assign workers to access consumers via the EVV mobile site, and that role will also review the documentation submitted by those EVV workers. This person will also submit claims for EVV delivered services. So they do have access to consumer records for whom you have an authorization, but it's limited access. They also have very limited access to your agency record in terms of what they're able to do. The billing agent role is designed specifically for people who all they do is submit claims on your behalf. This can be a third-party billing agent or an employee hired specifically for that role. It gives them access to everything that they need to do to be able to submit claims. There is no access to the consumer record. They are able to see your demographics in your agency record, and it have some limited access to notes to be able to communicate back and forth with you. So now that you have a basic understanding of the different roles and permission that are available within APD iConnect, you will be able to use the ID Pass system to request access for your employees. And again, this is just for agency owners because solo providers won't have employees. When requesting access for an employee, you will also define which role or roles you want your employees to have. The other thing that you'll do when requesting access is you'll determine whether or not that employee needs access to the APD iConnect application, the EVV mobile site, or both. Agency owners are reminded that when requesting access for an employee, they are indicating that the person needs to have access to sensitive HIPAA information to do their job. So I've mentioned a couple of times in this presentation that APD iConnect houses sensitive, confidential information. So when you think about it, password resets are kind of a big deal because the person that receives the reset, they take over the account access, whether they're the legitimate owner of the account or not. APD has put rules in place to prevent unauthorized takeover of user access. It's going to involve 2 authentication factors, and you can't use texts as one of those authentication factors. So you have 2 choices for your password reset authentication. Either you can enter your PIN in 2 separate voice authentication phone calls. So what that means is you have 2 different phone numbers and you've got to be by both of those phones, and you will get a voice call on each one of those numbers and you'll enter your PIN. The other option is to use a combination of the mobile authenticator app and a phone call. So you would receive a request on the Adaptive Authenticator app using your fingerprint or face recognition, and you would also receive a voice authentication phone call and have to enter your PIN. To start the process, you will go to the APD Access Control Portal login screen where you normally enter your username, and you'll go ahead and click Next, just like you always do. And when you get to the password screen, you'll see that there is a link for Forgot Password, and you click on that link to begin the process. And this is just a screenshot of that password screen, and you see right above where you enter your password is that little blue link for Forgot Password. Once you click on that link, you will be asked 2 times to choose an authentication method, either phone or the mobile authenticator app. Choose your authentication method and then follow the instructions. And again, remember, you have to do this 2 times before you're even prompted to enter a new password.